look at next to practice management and how scheduling and patient registration and check-in and check-out works within the system. First, let's talk about patient registration and scheduling. So in this example, I do have a single provider schedule for the day open, but for our offices that have multiple providers, we'll just add columns to our view. So in this particular case, it will have 3 columns, 1 for each provider. Now, some of my practices opt to template out their schedule, and the templates will look like this. So in this example, I have a double book at 9 o'clock for established patients and follow-ups. At 9:15 and 9:30, I have new patient exams, and then kind of rinse and repeat. 9:45 is established patients, and then I have an established patient and follow-up. In those cases, what I can do is just click on the visit. This is going to be a new patient visit, and then what will happen is it will allow me to book the appointment. It does remember the last patient we're working on. We're going to talk about that in just a moment. From here, I could fill in the appointment reason, I can fill in any additional notes, and saves the appointment. However, if this is truly a new patient and we don't have them registered yet, after searching, let's just say their name was Tony Janusa, we clearly don't find them in our list. In this case, I'll just hit the new patient button, and what that will do is allow me to fill in their demographics, collect their insurance information over the phone, and then their referral information and contact information. Now we'll book the appointment in this way. Now, as a reminder, once an appointment is booked, the system will auto-run eligibility for us. It will also auto-invite them to our patient portal. And then also there's a built-in appointment reminder system. So prior to their appointment, they will receive a text message, an email, or a phone call to confirm their appointment. What that leads into is when the patient actually gets here, we can go into our check-in screen. So this would happen usually a couple days after their appointment. This check-in screen, as a reminder, is going to show us those that are coming in for the day, those that are actually here right now, those that have completed their visit, and who never made it, so my no-shows. Most importantly, that when I click on a patient, this is going to load up anything we know about them. First, it's going to show me what forms they signed on our portal. Now, this patient missed a form, so what you'll have an option of doing of either sending them a text message, so they'll be standing right in front of you and say, hey, fill out your forms, or you can use a QR code and you can scan a QR code with the device and then hand that device to the patient, like a kiosk. This will also show that their benefits were checked and they were good. This will show their demographics, their billing information, and then also potentially a good faith estimate. What happens from there? If we want to, let's say, collect a copay on the patient, just hit the pay button. This will pull up our cash register. And from here, I can go ahead and collect a copay. And just as a reminder, we do have integrated credit card processing. So that means once you swipe that card, not only will it process the card, but it will post the money into the account. And then it'll ask you if you want to print or email that receipt for the patient. So that's sure the patient's checked in. Now, quick thing on checkout side, if we use the same patient, what will happen is that when we check out their appointment, it will immediately tell us the follow-up notes. This comes from the clinic side. So in this case, this patient needs to be seen in 6 months' time with the provider. When we hit the schedule button, it's going to go to our schedule, pull up that provider, go 6 months forward. Most importantly, when we go ahead and book this appointment, it's going to copy all the notes from that follow-up plan and put it inside our appointment for us.